Hello, I'm just making this video to inform viewers as a general health advice on the COVID vaccination and patients with blood disorders. And this health advice is just general, okay, and it's not specific to any patient in particular. And it will be based on the current consensus statements and guidelines as I'll go through with you. Okay, now the Malaysian Society of Haematology has come up with a consensus statement for patients with hematological conditions or blood diseases. Okay, this was issued in March this year. So this is an infographic. If it's a little bit small, you can expand it, and what you can see is basically almost everything is checked with some caveats. Okay, but so generally, if you have had a blood cancer like leukemia, lymphoma, okay, which you're now cured or you're a long-term survivor and you're any off treatment, that includes bone marrow or blood stem cell transplants. If you're already many years ago cured and off treatment, there's no reason why you can't have the COVID vaccination, receiving any of the currently approved vaccines. Okay. Now, if you have some chronic illness such as chronic myeloid leukemia, multiple myeloma, chronic lymphocytic leukemia, myelodysplastic syndrome, and the myeloproliferative neoplasm such as essential thrombocytosis or polycythemia rubra vera, there's also, generally speaking, no reason why you can't also undergo the vaccination against the COVID-19 infection. And I think it's important to recognize this because as you know, the pandemic is still raging, and the risk of getting ill or dying from COVID-19 is not insignificant, especially if you're older, more than 60 years old, and you have coexisting medical conditions known as comorbidities like heart disease, hypertension, diabetes, obese, lung disease, etc. And vaccination is important to prevent you from getting very ill with COVID and even reduce the risk of dying. Okay, now what about certain specific situations which are of concern? Now, if you are currently undergoing chemotherapy or on immunosuppression, or have recently had a stem cell or bone marrow transplant, like something like less than 3 months, then I think the concern is that the treatment may blunt your response to the vaccine. So here you have to discuss with your doctor whether or not the vaccination is suitable for you. Okay, now if you have a bleeding disorder such as immune thrombocytopenic purpura, a condition, an autoimmune condition where your platelets are low, if you have hemophilia, or if you're on blood thinners, either anticoagulants like warfarin, the newer anticoagulants, like apixaban, Xarelto, and so on. Uh, or if you're on aspirin or any antiplatelet agents, and the main concern is whether or not there will be bleeding since the vaccinations are an intramuscular injection. So the Malaysian Society guidelines are to use a small gauge needle as possible and to secure hemostasis. That means to press properly for a sufficient duration so that you don't have bleeding. Now, the some caveats are if you're on warfarin, you really need to discuss with your doctor to make sure your anticoagulation is stable, that you're not over anticoagulated, such as people with an INR more than 4. Okay. Um There's also guidelines, and I'll just share because the infographic may be a little bit small. I'll just share the guidelines from the MSH. Okay, for people with the new novel or direct anticoagulants and low molecular heparin, just delay the dose on the day of vaccination until after the injection, but you do not need to skip any doses. Similarly, if you are on platelet agents, you can continue the antiplatelet therapy such as aspirin or clopidogrel without any adjustment. Okay. If you are on dual antiplatelet agents, there's a higher risk of bleeding. So you really need to make sure you press for sufficient duration, and you probably want to discuss with your doctor. Okay, so I think these are the main concerns. So if you have a chronic illness like essential thrombocytosis, polycythemia vera, you're on medicines like hydroxyurea, low dose aspirin. These are by themselves not a contraindication, which means you can go ahead with the COVID vaccination. But if you have any doubts or concerns, please discuss with your doctor. Okay, now the reason why I've come up with this video is there's been some concerns about the AstraZeneca vaccine. Now, this vaccine has been very recently approved by the NPRA, which is the National Pharmaceutical Regulatory Authority, and it's safe, and they consider it a safe and effective vaccine against COVID-19 for adults 18 years and above. So I'll share the official document from the from the MOH. Okay, so if you can see, sorry, if the text is small, please use a big screen such as a laptop or a large tablet. So they say the vaccine is safe and effective for adults 18 years and above. The usual common side effects are pain, tenderness, tiredness, muscle aches, and so on. Now, the one which has been spreading like wildfire in the social media and so on are the rare side effects causing blood clots, or medical term is thrombosis. And it's a very unusual form of thrombosis because it's associated with low platelets. And the medical term is thrombocytopenia. So it's a thrombotic and thrombocytopenia syndrome, which is extremely rare. It's something like 9 per million doses, and then the rarity was such that it was not initially picked up in the clinical trials until many millions of people were vaccinated. Now you have to put this in perspective of people are having blood clots due to increased risk from other conditions. For example, a normal pregnancy, the risk of blood clot is something like 1 in 1,000. Okay, not even in 1 in 1 million, but 1 in 1,000, and it doesn't stop women from getting pregnant. Okay, now we are talking about 9 per million incidents, extremely small. Now, the question which some of you may have been asking is, if you've had a history of blood clot before, does this make it more likely? I think the mechanism for blood clot in related to the vaccine is very unique, and there is nothing to suggest that previous blood clots would increase your risk of this unusual mechanism, which is actually very different from the mechanism of blood clots in other disorders such as people from pregnancy, cancer-related blood clots due to smoking, prolonged immobilization, and so on. Okay, so you are not at higher risk of this vaccine-related blood clot. On the other hand, you have to also balance the fact that if you get COVID infection, that in itself will have quite a high risk of you developing blood clots. Okay, not to mention the risk of getting complications or even death from serious COVID. So if you are above age 60, have other health conditions, or the benefits of vaccination with this AstraZeneca vaccine far outweighs any risk of side effects. Okay. If you're a younger individual and without comorbidities, you may want to discuss with your doctor. But in general, you have to appreciate the fact that this adverse effect linked to the AstraZeneca vaccine is extremely rare. Okay. So, I think I hope this little short video will inform and educate you of the current status and consensus statements from the Malaysian Society of Haematology, and also the current position on the AstraZeneca vaccine. Understand that the government opened it up recently for on a volunteer basis, and the response was encouraging, in fact, overwhelming, until they've had to temporarily stop the enrollment. So I think, folks out there, please get yourself vaccinated. I think the only way we're going to beat this pandemic is to vaccinate as many people as possible. All right. If you have any doubts, always please consult your doctor, and it's best to do it in person because he will need to review your medical records, and perhaps you may need more recent blood tests, and so on and so forth. It's also been brought to my attention that you may need to be issued a pre-vaccine assessment form. Okay, this is something which we were not informed earlier. So you may need to come to see your doctor for a pre-vaccination assessment form to help the vaccine center screening staff to proceed to help you proceed with the vaccination process. Anyway, more on this. Please see your own doctors, and if and for specific health advice. Okay, thank you.